Have you ever heard of a mini stroke, and what exactly does it mean? The symptoms of a TIA and a stroke are identical, except the symptoms of a TIA are only temporary. However, it is so important if you are having a TIA that you get checked out immediately. A 57-year-old man presented to the emergency department with symptoms of temporary right-sided weakness and trouble with his speech. He was eating dinner with his family, and then all of a sudden he had trouble talking, and his right side of his face started drooping, and he had trouble using his fork. It freaked out his family, but within a few minutes, he was completely normal. His wife and his daughter forced him to go to the emergency department against his will because he thought he was back to normal and he did not want to miss Sunday night football. He's a little bit overweight, he has a history of high blood pressure as well as diabetes, and has smoked cigarettes pretty much his entire life. These symptoms were equally as worrisome to the emergency room provider, and they ordered a CTA of the head and neck as well as a CAT scan of the brain. There are two findings right here that are extremely important. And if this was not recognized, it could potentially cost this man his life. A CTA of the head and neck checks all the blood vessels going into the brain and supplying the brain to see if there is any blockages that could potentially result in a TIA or a stroke. And what we're looking at on this CT is this is the carotid artery, and right here is where it bifurcates into the internal and external carotid artery. We're looking at the same thing over here. And the internal carotid artery is what goes inside of the skull to branch into a variety of blood vessels that supply the brain. What we're looking at is this man has severe left-sided carotid stenosis, and also many of you guys noticed that he also has right-sided carotid stenosis. Although this one is not as bad as the left side. He has about a 70% blockage of his right internal carotid and a 90% blockage of his left. And if we think about how he presented and what the story was told, is he had temporary weakness on the right side of his body as well as trouble with his speech. And that localizes, my friends, to the left side of his brain. You see, the left side of our brain controls the right side of our body, and in most people, the left side of our brain also controls our language and ability to speak. So when he was having those symptoms during dinner, the left side of his brain was undergoing ischemia, or decreased blood flow, that could potentially lead to a stroke. But his symptoms got better and he was completely neurologically intact, so that, my friends, is called a transient ischemic attack, or a TIA. So let's talk about those and how important it is to recognize those, to do the workup and get them treated if indicated. Symptoms of a TIA really depend on what part of the brain is affected. It can cause numbness or weakness, typically on one side of the body, confusion or trouble understanding or expressing speech, sudden vision changes in one or both eyes, or even dizziness, trouble walking, trouble with their balance, and even falls. Cerebrovascular disease is incredibly important to recognize. 1 in every 20 deaths is because of stroke in the United States, and someone in the US has a stroke every 40 seconds. In fact, by the time you get done watching this video, there will be 10 people in the United States that have had a stroke. That's crazy. That's why I want you to know how to recognize a stroke and how you can prevent yourself from having a stroke. Risk factors include high blood pressure, high cholesterol, a family history, smoking, diabetes, and age. If you have any symptoms of a TIA or a stroke, it's so important to seek medical help immediately. We have a saying in healthcare that time is brain, meaning the quicker that you seek healthcare, the more likely a possibility is that we can reverse the permanent effects of a stroke that you may be having. Now, there are many different types and causes of stroke, so in this video, I'm specifically going to talk about carotid stenosis. That's narrowing of one of the major blood vessels in your neck that supply the brain. In fact, that's one of the reasons why I love lightning bolts so much, because your life can change in an instant, just like that. And when it comes to certain neurological diseases, time is of the essence. When a patient is experiencing stroke-like symptoms, there are a series of tests and imaging studies that we typically do to work this up. One of the imaging tests is typically a CTA of the head and neck, or CT angiography, to look at the blood vessels that supply the brain and see if there's any blockages. You can also look at the carotid arteries by something called an ultrasound. This allows us to see if there's any plaque buildup on those arteries. If we do identify carotid stenosis in a patient that experienced a TIA, time is of the essence. In patients with carotid stenosis, they are at high risk of having a full-blown stroke right after having that TIA. So depending on the degree of carotid stenosis, treatment is needed within the next 2 weeks. Although our patient is completely healthy and he's a 57-year-old guy, within the next 2 weeks he could potentially not make it if he had a stroke. So his family probably just saved his life. Patients with severe carotid stenosis, meaning 80 to 90% blocked, like our patient, and they're healthy and otherwise low surgical risk, it's typically recommended that they get revascularization within 48 hours. That means he potentially needs to be admitted and scheduled for surgery pretty quickly. How do we revascularize the carotid artery? There are 2 ways that we treat carotid stenosis. One is by endovascular treatments with carotid artery stenting, and the other is with open surgery called a carotid endarterectomy. It's essentially where we cut the blood vessel open and pull out all the gunk that's blocking it. Let's briefly go through the differences between these 2 procedures. For patients that are symptomatic and healthy with severe carotid stenosis, typically an endarterectomy is recommended. And endarterectomy is a surgical procedure that is typically performed by vascular surgeons or neurosurgeons to help open up the carotid artery. Make an incision overlying the carotid artery on the front part of the neck, open up the blood vessel, and remove all the plaque out of the inside of the artery. Once the plaque is removed, we then sew up the carotid artery. It is an open surgical procedure, so it carries a few different risks as compared to stenting. That can include increased risk of infection, bleeding, and risks related to anesthesia. Carotid artery stent is a minimally invasive procedure where a catheter is typically placed in the patient's groin or another access point where we place a wire through the narrowed lumen of the blood vessel, inflate a small balloon to open up the artery, and that's followed by a stent to open up that blood vessel and to hold it open. It is minimally invasive and has a shorter recovery time, but in certain patients there may be a slightly higher risk of developing a stroke after this procedure, having an embolism or a small clot break off of that plaque, or over time you can have restenosis or narrowing of that artery. Usually after a stent there is a need for dual antiplatelet therapy, meaning the patient has to take 2 different types of blood thinners. Depending on a variety of factors, including how narrow your blood vessels are, what type of surgical risk you may be, and how your symptoms are, your doctor may choose one procedure over the other. In our patient's case, he was admitted to the hospital and underwent a left carotid endarterectomy the next day by the vascular surgeon. He did great after surgery and recovered within just a few weeks. He's talking to his doctor about having the other carotid artery treated since we know he's at risk of having a stroke on that side. And after smoking almost his entire adult life, he's finally called it quits. And remember, if you or a loved one experiences any signs or symptoms of a stroke, even if it's temporary, it's so important to seek medical advice immediately. Another case of patient-focused and compassionate care. Stay tuned next week and I'll go through another case.